It is very difficult to get clinicians to use IT systems. Some physicians are not in favour of using computers at any time. Sometimes, though, they can actually see this as a significant benefit, and some of the previous detractors have said, well, look at this, I can actually now review my medicine chart from home when I'm on acute call. I can prescribe from home when something is clearly not to my liking. They can review what the house surgeon has done during the day from their desk without having to walk around and look at charts. They've also been able to cease medications that should have been ceased, antibiotics particularly, much more simply from wherever they are. So they have seen benefits, and uptake is improving over time. There's a group of relatively junior consultants who took to this like a duck to water, and they have absolutely no intention of ever going back. There's a group of junior doctors particularly, and they're the fastest to take this up, who get quite annoyed when they have to move off the ward where it's not being used and have to do very, very slow discharge summaries with transcription errors, and on some occasions we've been phoned from the emergency department thinking that this was a support call by a junior doctor who says, I've just prescribed 30 medications and it took me about 2 minutes and this is fantastic. So we're getting lots of bouquets from that. We've also had a number of registrars who have been going into research and saying, well, can I potentially use all this medication listings to do a search and say, well, how many people are using this version of atorvastatin, or how many people are coming in with a certain medical condition and being discharged with the correct medications? And the answer is now, yes, we can work this out for you, and yes, we can support this, something which would take them weeks of work beforehand. So yes, it's a slow process, and it's not going to be something that has universal acceptance overnight. But you've got to sustain the vision of what you're trying to achieve and continue to try and support the junior doctors, the senior doctors with what they can and can't do. But it is going to be very important to make sure that it is the system that almost everyone uses. Otherwise, moving in and out of a paper and electronic system is annoying, and I think it's going to detract from the overall benefit as well.